The way you stand could be causing your blood pressure to spike and also affect your overall health, especially if done constantly. So here are some common ways you probably have been standing that may have been stressing your health and your blood pressure. Number one, constantly standing still with your knees locked or hyperextended. I will explain that. First, look at the picture I'm showing you right now. That's what it means to stand with locked knees or to hyperextend your knees. When you're standing in such a way that you tend to totally straighten out or stretch your knees. You can try it now as you're watching this video. You're standing, you're stretching out your knees totally, so much so that your legs tend to be pushed backwards, forming a kind of curve. What you're doing in this case is that you're putting a lot of pressure on the joints, the ligaments, the bones in these knee areas. And over time, you could start experiencing knee joint pains. There could be ligament tear that may make it difficult for you to walk or even cause you to experience more excruciating pains. Aside that, if you keep standing in this position, it becomes difficult for blood to be returned back to the heart. As a result, blood tends to collect, to pull in your lower legs, and this can cause leg swelling, feet swelling, ankle swelling, which can make your legs feel heavy and uncomfortable. Another thing that can happen is that because blood cannot be adequately returned to the heart, it may be difficult for blood to get to other organs like your brain. So you could also experience symptoms of reduced blood supply to the brain, like headaches, dizziness, amongst other symptoms. So to avoid this, make sure you are standing straight. If you have to stand for longer, maybe because of the nature of your job, try to take a walk. For every 1 hour you're standing, take about 1 to 2 minutes of walk in between, or try to sit down a little while. If you cannot achieve this, then you could be shaking your leg from side to side as you're standing, or try to bend your knees often as you're standing. Number 2, leaning on one leg for long hours. This is a position I found myself at one time or the other. This often happens when you have to stand for long periods as well. Like when I used to work in the emergency unit of the hospital sometimes, and I had to attend to a lot of patients overnight, I realized that my legs are tired, and in order to support it, I just find myself resting on one leg, putting all my whole weight on one leg. When you stand in this position, your body tends to shift toward that side. Your hip is bent, and before you know it, you could be putting a strain on your hip joint, and you could start experiencing waist pain, hip joint pain. You could also be putting pressure on the knee joint in that area and also experiencing knee pain. Aside that, you are putting a lot of pressure on the veins of that particular leg, and this strain can activate your stress response, causing the stress hormones to be released, hence causing your blood pressure to rise, as well as other consequences of increased stress, fatigue, tiredness, and the rest of that. So to prevent that is the same thing you should still do. Try to take a walk within every 1 hour, about 1 to 2 minutes of walk. If that is not achievable, try to